Hi, everyone. Thank you for joining today the Your Health Survey Report webinar. I'm Jessica Mason-Piclo, Senior Vice President and Executive Editor of Rewire News Group, the nation's one and only media outlet dedicated exclusively to reproductive and sexual health rights and justice. The webinar today aims to highlight Power to Decide's 2024 Youth Reproductive Health Survey and present selected findings on young people's knowledge, attitudes, and experiences about contraception and abortion from the 2024 Your Health Survey Data Report. We have a lot of ground to cover, and I'm going to go through a real quick run of show and introduce the folks who will be presenting, and then we can get into it because an hour is not nearly enough time to hit all of the things that we need to talk about today. So, as I mentioned, we will do a quick overview of the survey and followed up by a moderated Q&A, and then open it up to questions from the audience, which I will facilitate as well with a quick close. So let's get into it. Let me introduce the speakers and really start to get to the meat of the matter. Dr. Riley Steiner is a public health behavioral scientist by training who serves as the Senior Director of Research and Evaluation at Power to Decide, where she leads the organization's scientific portfolio, including the Your Health Survey. Prior to coming to Power to Decide, she spent a decade working on adolescent sexual and reproductive health at the Centers for Disease Control and Prevention. Her research focuses on improving young people's access to quality sexual and reproductive health care. Ciara Larson is the research manager at Power to Decide, where she coordinates multiple aspects of Power to Decide's scientific portfolio, including design and implementation of research studies and engagement with external researchers. Prior to coming to Power to Decide, Ciara engaged in community-led reproductive research with the Center for Reproductive Health Research in the U.S. Southeast at Emory University to improve Southerners' experiences navigating abortion restrictions. Dr. Reagan McDonald Mosley is the CEO of Power to Decide and a practicing OBGYN who provides reproductive health care, including abortion, to her patients in Baltimore, Maryland. For years, Dr. Reagan has fought on the front lines to ensure all people have the right to proper reproductive health care. From Capitol Hill to her Ask Dr. Reagan series on TikTok, which is phenomenal and I cannot recommend enough. To the exam room, Dr. Reagan brings decades of knowledge, passion, and compassion to her work. Inspired by her time in Tanzania studying the causes of maternal mortality, Dr. Reagan has spent her career fighting to ensure that all people, especially those who face the greatest barriers, have control over their bodies and power to decide their futures. And last but not least, Dr. Laura Lindberg is a professor at the Rutgers School of Public Health, where she directs a new program in sexual and reproductive health rights and justice. She has been a leading researcher of adolescent sexual and reproductive health in the United States for decades, both designing new surveys and providing the field with key analysis of national data. She is also a founding member of Youth Reproductive Equity, a collaborative promoting equity in abortion access for young people. Previously, she was a research scientist at the Guttmacher Institute for nearly 20 years. I'm just happy to be on the same panel with these bright minds and leaders in the field. So without further ado, Dr. Steiner, I'll send it over to you.
Thank you so much, Jess. We're so grateful for your engagement in this webinar. And really thanks to all of you for taking the time out of your Tuesday afternoon to join us. I'm going to kick off our presentation with some key context about the Your Health Survey. So the Your Health Survey is a national survey that measures young people's knowledge, attitudes, and experiences related to sexual and reproductive health information and services, with an emphasis on contraception and abortion. It is intended to complement existing behavioral surveillance systems by focusing on factors that we know impact access to care and ultimately sexual and reproductive well-being. The objectives of the survey are really threefold. We will be using the data to inform Power to Decide's programs, including Bedsider and Abortion Finder, which aim to increase young people's access to trusted, resonant, and accurate information. We also will use the data to examine trends over time so that we can monitor progress toward Power to Decide's organizational goals. So things like increasing awareness of services, acceptability of seeking out services, and receipt of desired contraception and abortion care. And finally, we hope that these data will really help address key gaps in the field. Many of the national surveys that cover sexual and reproductive health do not focus on information and do not address abortion. And of those that do, minors are often excluded from study samples. We conceptualize the Your Health survey as a repeated cross-sectional survey, meaning that we will field it routinely, but with a distinct sample each time, as illustrated in this figure. We plan to conduct the full 12 to 15-minute survey in even years and an abbreviated 5 to 7-minute survey in odd years. The abbreviated survey will focus on indicators we imagine might change more rapidly and give us an opportunity to address emerging issues like major policy changes. We plan to field the survey each summer with a target sample of 1,000 young people aged 15 to 29 years assigned female at birth. And our goal with each cycle is to release data in the mid to late fall of the same year as fielding so that the findings are especially timely. We were very intentional in our approach to developing the Your Health Survey instrument. So to the extent possible, we drew on existing surveys like KFF's Women's Health Survey, as well as established measures like the Person-Centered Contraceptive Counseling Scale and the Contraceptive Concerns and Beliefs Scale. We piloted select items as part of a data collection last fall for our 2023 Thanks Birth Control campaign. And we also conducted cognitive interviews with 6 young people, focusing on newly developed or substantially adapted items. Finally, we had the great privilege of being able to incorporate feedback from our research advisory group, which consists of 10 national sexual and reproductive health experts, including our panelist, Laura Lindberg. The survey questionnaire is available in full on Power to Decide's website. So at a high level, these are some of the key domains that are covered in the survey. Recognizing that what young people know and think about abortion and contraception influences their access to care, we address a variety of constructs relevant to information, including information sources, knowledge, awareness, and attitudes. And we also examine service provision. Given some of the challenges with abortion measurement and the size of our sample, which in the 2024 survey included only about 200 respondents who had ever been pregnant, we delved deeper into contraception than abortion. The survey also includes some items about recent and lifetime sexual activity and a few related to STI prevention. The Your Health survey is administered via Ipsos Knowledge Panel, which is the largest online probability-based panel in the US. Ipsos uses address-based sampling to recruit individuals into the panel, and then panel members are invited to participate in specific surveys. Minor participants are recruited through a parent panel member. To align the survey-specific sample with the US population, Ipsos provides weights for minor samples, adult samples, and combined samples using demographic benchmarks from census data. Weights for our 2024 survey were from the 2023 March supplement of the current population survey and are based on age, race and ethnicity, census region, metro status, income, and education. So, our inaugural survey was fielded during a 6-week period this past summer with 1,200 respondents. The overall survey participation rate was 53%. This table provides a few of the sample characteristics that we looked at with weighted percentages and unweighted sample sizes. We oversampled minors who made up about 20% of the weighted sample. About half were non-Hispanic white and 1/4 were Hispanic. Nearly 40% were from the South. And although not shown here, I wanted to note that about 55% reported ever having had penis-vagina sex, and about 40% reported having had sex in the past 30 days. So I mentioned that the survey questionnaire is available on our website along with a method supplement about the Ipsos Knowledge Panel methodology. And we provided all these resources on this page dedicated to the Your Health survey. Also available on the page is our 2024 data report, which we released about 6 weeks after data collection wrapped up. The report presents descriptive findings for select indicators from the 2024 survey. We report weighted prevalence estimates and examine bivariate differences by age, given the inherent developmental differences among the range of young people included in the survey. All of our analyses were weighted using the combined sample weights. The report highlights 5 key takeaways that are listed on this slide. My amazing colleague Sierra is going to walk through some of the data that's underpinning these conclusions. But I did just want to note that the data we're highlighting today are really just a fraction of what's presented in the report. So hopefully it will spark your interest in learning more. Sierra, over to you.
Thanks for sharing that context, Riley. Let's dive into some of the 2024 Your Health Survey data. So we found young people are not getting information about contraception and abortion from their preferred sources. The figure on the left illustrates this point that young people are not necessarily getting information about contraception from their preferred sources. The y-axis presents the information sources, and for each source, you see 3 lines which reflect 3 separate indicators. Where you tried to get information in the past year is in dark blue. Where you've gotten information in the past year is in orange. And if you needed information, where would you like to get it is in light blue. You can see that overall, about 80% of participants wanted information about contraception from healthcare providers, but only about 1/3 actually received information from providers in the past year. You can see a similar pattern in terms of discrepancies between preferred and actual sources for websites and parents. It's also worth noting nearly half did not receive any information about birth control in the past year. The figure on the right illustrates where young people want to get information about abortion. We don't present estimates for tried to get or actually got information about abortion in the past year by source because only about 20% of young people had reported receiving abortion information from any of these sources in the past year. You can see that, like contraception, healthcare providers were the most common preferred source, followed by websites. We adapted a measure from the Person-Centered Contraceptive Access Project led by the Sexual Health and Reproductive Equity Program at UC Berkeley. We assessed young people's perceptions of whether they had enough information to make contraceptive decisions. Findings indicate that some young people, especially minors, had lacked the information that they needed to make informed decisions about contraception. About 1/3 had reported insufficient information to make a decision about whether using birth control now is right for them, and nearly 1/3 reported insufficient information to make a decision about what birth control method is right for them. As you can see, for each indicator, more younger participants were lacking information. We know from prior research led by Dr. Anu Gomez that having sufficient information is an important predictor of contraceptive access. Young people's perceptions of insufficient information aligned with our findings from an objective knowledge assessment included in the survey. Participants were presented with 11 statements and asked to indicate whether each were true or false. I don't know was also a response option that they could select. This table presents the responses to each statement in descending order by the proportion correct. On average, respondents only answered about 5 of the 11 statements correctly. Many participants had also reported "I don't know" to the statements, with proportions ranging from about 20% to 60%, depending on the statement. We wanted to highlight the incorrect findings for a few specific statements. 22% said it was false that if someone has penis and vagina sex, condoms are the only method of birth control that can be used to prevent sexually transmitted infections. 23% said it was true that menstrual cycle tracking apps are a highly effective way to prevent pregnancy. Nearly 20% said it was true that people should take a break from birth control every couple of years for health reasons. And close to 30% said it was false that teenagers under the age of 18 can get birth control pills over the counter without a prescription. Like self-perceptions of sufficient information, for most statements, more minors answered incorrectly or said they did not know, although that data is not shown here. We also used an adapted version of the contraceptive concerns and beliefs scale developed by colleagues at UCSF. We found that concerns about hormonal contraception are common among young people. For example, as you can see on the far left, about half worry about birth control having dangerous side effects. And to the far right, you can see about 1/3 worry that birth control can affect their future fertility. You can see that this graph and those that follow present overall estimates in magenta and the age stratified estimates with 15 to 17 years in dark blue, 18 to 24 years in orange, and 25 to 29 years in light blue. For each item about contraceptive concerns, more 18 to 24-year-olds had reported worries about hormonal contraception compared with other age groups. Several findings suggest also that some young people need more support accessing contraceptive care. This figure presents awareness of various contraceptive service delivery options. Most, though not all, respondents were aware that they could obtain contraception prescribed by a healthcare provider at an in-person appointment. However, only about half were aware of prescription methods provided through telehealth, and even fewer were aware of pharmacy prescribing, over-the-counter availability, and birth control mailing services. Given that O-pill was recently approved for over-the-counter access, it will be important to monitor awareness of over-the-counter options moving forward. Again, as you can see, for each indicator, fewer younger participants were aware of the service delivery options available to them. This survey includes self-efficacy indicators, and our findings indicate that some young people need more support accessing contraceptive care in this area. While we found many young people were completely confident taking each action related to contraceptive care, there's a notable minority who are not. As examples, about 40% of young people are not completely confident they can find a healthcare provider they trust to provide birth control services. And about half of young people are not completely confident that they can start a new birth control method if they wanted to. Aligning with the contraceptive findings, young people need more support accessing abortion care. This figure illustrates awareness of types of abortion. Most young people reported having heard of procedural abortion, and about 2/3 were familiar with medication abortion. Only about 1/3 were aware of telehealth medication abortion and self-managed medication abortion. We found more than 1 in 10 young people had never heard of any of these abortion methods. This graph presents responses to an adapted version of IPASS's abortion self-efficacy scale. Across indicators, less than half of young people were completely confident they could perform each task if they wanted or needed an abortion. Only about 1/3 of young people were completely confident they could find a provider they trust to provide abortion care. Only about 1/4 were completely confident they could pay for the cost of an abortion. For these and other tasks in the scale, more minors were lacking confidence compared with other groups. Although the 2024 data report is focused on descriptive findings, we intend to look at associations and further analyses. One of the key outcomes of interest will be use of preferred contraceptive method. We assess this person-centered measure of contraceptive access, also developed by the SHARE program at UC Berkeley, among current and prospective birth control users. We define prospective users as those who are not currently using a method, but who indicate that there is a method they would like to use. We found that only 2 out of 3 respondents were using their preferred method. Among the third not using their preferred method, the most common preferred method was birth control pills, the hormonal IUD, and the implant. We hope these findings encourage you to go check out our website and look at the report to learn more. And back to you, Riley.
Thank you so much, Sierra. So we just want to wrap up our presentation with a few comments about limitations and next steps. Of course, there are some limitations to the survey overall and our 2024 data report. We only recruited respondents who could complete the survey in English, in large part because Knowledge Panel estimated that only about 5% of 18 to 29-year-old respondents would be Spanish language respondents. In future cycles, we may oversample Hispanic participants, in which case we would field a Spanish language version as well. We also excluded individuals assigned male at birth, even though many of the items about information are relevant to this population. We do have to worry about potential selection bias and social desirability bias, especially for minors given the recruitment through their parents. And even with oversampling minors, we still had a small sample for some indicators that were examined among a subset of respondents. On the analytics side, the data report does not present estimates stratified by other key characteristics beyond age, like race and ethnicity or geography, and only descriptive data are presented. We hope to address some of these limitations of the data report through additional analyses, which we plan to disseminate via peer-reviewed manuscripts and other forums. We plan to expand our analyses of contraceptive knowledge and contraceptive concerns, considering differences by race and ethnicity, income, region, and urbanicity. We also will examine multivariable associations with salient predictors, like information sources, and outcomes, like use of preferred contraceptive method. We also plan to use the data from the survey to further characterize the provision of contraceptive care. We didn't really focus on these data in this presentation, but we have a variety of indicators that look at the quality of care provided. And I'll just highlight one key finding, which is around missed opportunities for providing contraceptive services during routine preventive care. Finally, Sierra will be leading an analysis looking at abortion, knowledge and attitudes, and considering differences based on state-level abortion restrictions. We invite others to use the data as well. So if you're interested in conducting a secondary data analysis with the 2024 Your Health Survey data, please reach out to us at data@powertodecide.org, and we can work with you to set up a data use agreement. We also encourage you to help us share these findings, and we have some resources on the Your Health Survey webpage to support dissemination efforts. These include a one-pager with the key takeaways that we've highlighted here, and additional one-pagers are forthcoming. We have graphics that can be used for social media, like the one highlighted here, and a blog post with some data highlights. The recording of this webinar will also be posted there. So with that, I will just conclude by acknowledging the many, many colleagues at Power to Decide who have supported this effort, as well as our external contributors, including our research advisory group members. Thank you all so much. I'm really looking forward to hearing Reagan and Laura's perspectives and answering your questions.
Amazing. Thank you so much, both Riley and Sierra. And for folks who are joining the webinar, if you have questions, be sure and place them in the chat. We have one already teed up, and I'm going to get into the moderated part of this because we are cruising on time. So my first question is for Dr. Reagan. As a new initiative of Power to Decide, what do you see as the value of the Your Health Survey for your organization and for the field?
Yes, thank you for this question. And I want to thank Riley and Sierra for their work on this, as well as the rest of the Power to Decide team. It's a really vital step in the foundational work that we have been doing as an organization over the last 3+ years to redefine our mission, which is to advance sexual and reproductive well-being for all with a focus on those who face the most barriers to information and access. Our updated mission furthers Power to Decide's deliberate and, I feel, important pivot away from our previous focus on reducing unintended pregnancy as an organizational North Star and goal. And our new mission better demonstrates alignment with our articulated organizational values of autonomy and health equity. So this means that the data by which we measure and assess our work as an organization also needed to change to be consistent with our refreshed mission, vision, and values. And so the rich findings and the data in the survey provide us with an important benchmarks regarding the current status of information, knowledge, attitudes, and behaviors regarding contraception and abortion, as well as Riley shared, measures exposure to our digital tools as baseline metrics that we can now utilize over time as we adapt and change our work and initiatives. So overall, this critical data and approach will allow us to take a more evidence and data-driven approach to our work, projects, and initiatives. And the survey also revives the historical efforts of adding important data and evidence to the field writ large, which the organization did formally with the fog zone study, which found that young people felt that contraception was ineffective largely and that they underestimated their risk of pregnancy. So the Your Health survey has provided key benchmarks and data by which to measure and assess the impact of our organizational work over time. And moreover, we hope contributes to the broader field in hopes that the data will be utilized by others to fill in gaps and needs and devise projects and programs to improve access to information and services regarding sexual and reproductive health and well-being.
What an important and exciting step in that direction. I'm excited as a member of the media and reproductive health and justice community to see where this goes, not even as a fellow researcher. Dr. Lindberg, question for you. Given your expertise in survey research on this topic, how do you see the Your Health survey being useful for the field generally?
Well, I really want to applaud and thank Power to Decide for shepherding this new resource, which I think will be very valuable to the field. So I want to highlight some of what I think are the key advances here. And one is so obvious, but it needs to be said, which is it's an advance to be focusing on young people, especially minors who are too often left out of research. We just haven't had enough recent data on sexual and reproductive health for this age group, especially those under 18. And we cannot count on federal and state data systems to ask the questions that we want and need. This has always been a challenge, and it's likely to only be getting worse as we go forward. So I commend Power Decide for their initiative and their willingness to step into the gaps in our data systems and measurements. I'm thrilled to see that this survey measures more than just that narrow metric of contraceptive use. Instead, it's taking a more holistic approach towards contraception, caring about young people's knowledge, attitudes, and preferences that are all part of their access to patient-centered care. And I think this is taking us far beyond the outdated ideas that the primary public health goal is that all sexually active young people use contraception however you achieve that goal. Instead, the focus is now on young people's own sense of their needed preferences, and that is that we, as researchers and advocates and providers, approach young people with respect and support for their autonomy. I love that this survey approaches abortion as part of the continuum of reproductive health care and doesn't exclude or silo it. And importantly, it doesn't just focus narrowly on the metric of if people have had an abortion, but on self-efficacy for abortion care if it was desired. And finally, the last thing I want to highlight is that this survey can really help us grapple with the risk of misinformation and disinformation and how this relates to young people's concerns about contraception. I was involved in designing the original fog zone study so long ago. And I would just say that everything old is new again. When we asked young people decades ago, they had a lot of misinformation about contraception. That's still the case, but I think the sources and some of the implications of the misinformation have shifted, and this survey can help us to understand that.
Thank you so much. I will say that one of the things that stood out to me when I first saw the study and the results that were released to somebody who's, done reporting and analysis in this field for over a decade was the focus on the autonomy of young people. That is so either skipped over or just disregarded entirely. And as we all know, young people are so often the canary in the reproductive healthcare coal mine, where policies are sort of trotted out around and in name for their benefit, but rarely with folks actually taking their thoughts and needs into account as described by themselves. So that was, in my opinion, something that and so when you said autonomy, in fact, my notes had it right there. I was scribbling it as like, this is what's so cool about it. So a question for both of you. What was one finding from the 2024 data report that really stood out to you and why? Dr. Reagan, let's start with you.
Sure. So this might seem counterintuitive since I am a provider, but I was actually really surprised that 80%, such a big number of young people, said that they wanted information on contraception and abortion from a provider, but only 33% and 3% respectively received it in the last year from a provider. I was surprised, and I would say pleased by this number that it was so high. Frankly, if I had hypothesized, I would have thought that their, primary preferred source of information would have been like social media or the internet, parents, friends, champions. And frankly, I think in part like the deliberate efforts that were done during the pandemic to undermine trusted health institutions and frankly denigrate providers would have made this number lower. So I was pleasantly surprised, I would say, but I wouldn't have guessed that number was so high. I'm also frankly concerned that that number is so high because I worry that our health institutions are not set up to meet the need of this desired source, right? Like many health centers have long wait times. They have policies and operations that are often not teen-centric. They often lack person-centered care to ensure that people are able to get their desired method without coercion, judgment, or unnecessary barriers. So I think that this is surprising, but also a huge opportunity, and an opportunity for us at Power to Decide to think about our intersection as an organization that reaches people in the digital space, but also has a provider voice, and allows us to think about how we could do that more deliberately and holistically.
Dr. Lindberg, what about you?
Yeah, so one of the findings that stands out for me is what clearly is a need for more information about new sources of contraception and abortion care, be it pharmacists, online providers, over-the-counter access. Overall, only about half of young people knew about telehealth care for contraception or availability without prescription, such as Opal, but you'd think more would have said they knew about it because condoms have always been there without a prescription. So there seems to be some gap here. And only about 1 in 3 respondents knew about telehealth abortion. So at some level, I don't think these information gaps are necessarily surprising, given that the current landscape in which just the types of contraception that are available, sources of cares, and the laws around them are rapidly changing and increasingly diverse. And when you look at the data by age, I don't even know that we should consider this a problem just for young people. There was very little difference in knowledge and awareness between those who were 18 to 24 and 25 to 29, which suggests that if we looked at older reproductive ages, we might see the same issues. But the question we'll need to address for practice is how do we help young people, and really I think people who need contraception of all ages, get information about contraception and abortion from sources that they trust and prefer. And that last part is really important. If you just pile information at them, but they don't value the source or they question its validity, it's not going to do much.
I found that the similarity in knowledge gaps among the age cohorts fascinating as well. As somebody who has a child in each of the age cohorts, it kind of blew my mind that they could be having such wildly different life experiences at that time when you think of like what your life is at 16 versus 26, but yet there's not necessarily a growth of in terms of access to information there. Just again, some of the findings for as a civilian here that jumped out. Dr. Reagan, you had mentioned this in your previous answer, but I want to go back to it a little bit. The report underscored the importance of providers, as you said, in ensuring young people have information about contraception and abortion that they trust. With that in mind, what resources would you recommend to other providers to support such health information and education?
Yeah, thanks for that question. I mean, obviously, I'd love to highlight the resources of Power to Decide, such as Bedsider, upon which we have an enhanced method explorer. So I invite everyone to check it out, where people can compare side by side different methods of contraception with information about side effects, impact on bleeding, efficacy, privacy, and more. And that was recently updated using the best-in-class approaches for health information, accessibility, and health literacy. There's also a companion website called Bedsider Providers, which is geared to keeping providers updated with important sexual and reproductive health information to help them better serve their patients ideally. And then, of course, abortionfinder.org, which is the largest national database of abortion providers, abortion funds, and practical support organizations. And we have amazing staff members that are calling health centers, abortion funds, and practical support organizations and keeping this updated every single day. As was mentioned earlier, we are doing a lot of work on social media to meet people where they're spending a lot of time. TikTok, Bedsider, it's TikTok and YouTube with our Bedsider platform, and we have the hashtag Ask Dr. Reagan series there. We also have other voices and messengers that are providing information in this space, where we're creating videos in a sex-positive manner that's hopefully resonating with young people. UCSF has, Beyond the Pill, has great trainings and patient education tools and resources that I'd love to highlight. And for those within the Title X system, the Clinical Training Center for Sexual and Reproductive Health has also great trainings and educational tools.
Amazing. Thank you for that. And one final question before we turn it over to audience Q&A for you, Dr. Lindberg. What future analyses do you hope to see using the 2024 data, and what would you like to see from this data collection going forward?
So as a survey researcher myself, I know how hard it is to pare down questions for a 12 to 15-minute survey. And I'm amazed by how robust this set of questions is, but I think there are a few more things going forward that could be considered. So one of them would be to think of how to refine the measures of information sources and knowledge that really reflect the changing information landscape, whether that's new sources of information, how much of it many of us signed up for Blue Sky in the last 2 weeks, or new barriers to information that are going to pop up, particularly around abortion if some of these state level lawsuits are successful. And to think about how the different types of information and misinformation are linked to behaviors. I'm also really interested in an opportunity in longitudinal follow-up, especially for the youngest participants who may be expected to have the most change as they become sexually active. So that's something that could be leveraged from this data. I really want to encourage, to the extent possible, oversampling to focus on the potential threat to Title X users, given the emergent threats to this key safety net provider. And if you all aren't following, follow Jess, follow Rewire News. That's really one of the only places I see this being discussed, and it's critically important, particularly for minors. But again, they are coming for minors first to limit access for all. So this just builds on that. And then Dr. Steiner certainly mentioned this, and I'll just lift up how great it will be to have analyses which explore the intersecting demographics so that it's not just age, but it's by race, income, and geography. We know more than ever before that zip codes are becoming a key determinant of access to sexual and reproductive health care. And increasingly, it's going to be not just care, but knowledge is going to be limited by the zip code that you live in.
Thank you all. And not surprisingly, we have a pile of questions lining up in the queue. I would be surprised if we are able to get through all of them. So please continue to submit them as we do the discussion, but really there's so much to go through. So I'm going to start first with a question by Christy Hackett. Do the panel members have a sense of what might be driving concerns regarding hormonal contraception among young people? What's the best way to push back against misinformation around hormonal contraception in this age group? I'm thinking about the current MAHA forces at play, the Make America Healthy. Again, this is the place where I spend so much of my free time in this conservative social media spaces. It's a really wild place to be. And worried about this movement may further erode trust in proven contraceptive methods. Thoughts from the panel?
Yeah, I'm happy to start. I mean, I am also concerned about sort of like the wellness movements on social media. And I think, you know, some of the language that they're using and co-opting is dangerous in that it's sort of denigrating to contraception and hormones. And I, you know, think it's really important to push back and say, like, you know, hormones are not for everyone, and that's why it's important that people should have access to the full scope of methods. And if someone has personal medical history or family history or just a preference to avoid hormones, like that's great. But it is also true that like millions of people take contraception with hormones and do just fine with it. And I was really particularly disappointed by some of like the newer contraceptive methods. I'm thinking about Phexxi in particular that have come to market, and the ad campaigns that I felt like really, you know, spoke negatively and denigrated hormones. And I hope we can get to the space where we can like be excited about new methods and non-hormonal methods while not speaking negatively about hormones, because we don't want to like run people away from using hormones. And we know that like this has real world impacts, that people are stopping their method because they're concerned about what they're seeing on social media, and also that people are not starting methods. And I think it's also like a real challenge for us as providers and for those of us who are doing work, particularly in the social media space, because there are real, you know, complications sometimes of birth control, right? And someone's individual story is very real and concrete and happened to them, and yet does not necessarily reflect like the overall risks from a public health perspective of a particular method. And we have to be able to carry those tensions and those realities at the same time while explaining to people what the real, you know, risks are of contraception.
Yeah, I would just
Yeah.
add to that, that one of the things that I see in the data, which was interesting to me, is that it's minors, those 15 to 17-year-olds, who are actually less worried about hormonal contraception. And I don't think that's because they're all happy, smiley face about hormonal contraception. I think they have less information and they're less exposed to these channels of communication. And then as they start looking around, as they engage, that exposure happens. So I think we need to be paying more attention to what's the entry point to this information, and the age patterns give us some indication that something's going on there.
That's really interesting. I hadn't considered that at all. A question from Catherine Cohen. For this data about insufficient information, do we know if these young people saw a healthcare provider? That is, does the data indicate that the provider isn't getting the information that they want, or that they aren't accessing the care?
Yeah, I'm happy to take that. So we haven't yet looked at associations between sort of the information sources and perceptions of sufficient information, but it's definitely on the list of analyses. But I can share that I mentioned, sort of missed opportunities for providing contraceptive care in the context of preventive care. And so we found that overall about 3/4 had a preventive care visit in the past year, and fewer than half had their provider talk with them about birth control at that visit. So lots of missed opportunities there. And overall, only about 38% indicated that they received any health care about birth control in the prior year.
Thank you. Anyone want to follow up or add anything? Okay. A question from Renee Sieving. I hope I got that last name correct. What are Power to Decide's plans to partner with providers, professional organizations like AAP, NAP, SAHM, et cetera, to get this information out to providers and to think together about next steps?
I'm also happy to kick that off, and Reagan may have some thoughts to share as well. So we are, I really appreciate the question, because certainly, as we've talked about, like the implications for providers are pretty profound. And so we're thinking about kind of our strategic dissemination efforts with these professional associations. But then we also have some work underway to really think about how we can partner with providers to provide Bedsider as a patient education resource. And so I think that as part of those conversations, we'll be sort of drawing on these findings to sort of talk about how Bedsider can be used to provide young people with information about sexual and reproductive health, contraception, and abortion, so that we can address some of these gaps.
Yes, everything Riley said, and just, this is a part of our more holistic approach to thinking about how we work with and through providers to improve the sexual and reproductive well-being of our priority population. And in part, we're doing some user experience research now to better understand sort of the needs of providers and hopefully be able to meet those better soon. And if anyone has suggestions or connections or would like us to do a briefing for their professional organization, we'd be happy to do that. So let us know.
Amazing. Thank you. A question from Sam DeFaz. Any takeaways that you think might be especially relevant to LGBTQ teens?
It's not explicitly stated in here, but I think this goes back to trusted sources, which is when you've been left out of conversations, maligned, treated poorly, whether it's by a classroom teacher, peers, a healthcare provider who doesn't recognize who you are and speak to your needs. When they do finally say something that should be of value, you may no longer be listening. So we need all the conversations leading up to this to be respectful and to allow for that autonomy of young people. So when there finally is this concrete information, it's heard and responded to.
Yeah, I 100% agree. And I would say, just from my own clinical experience, that's exactly right? Like in thinking about even sort of our forms and how gender inclusive we are and the pictures on our walls and the colors on our walls, like all of those things, we want to make sure that we have LGBTQ folks centered in our clinical settings and how we take care of people. Because if we don't, just as Dr. Lindbergh said, like by the time we get to trying to address their specific needs, they may have already checked out. So critically important.
And then, of course, let's just raise up that the attacks on gender affirming care are attacking the same hormones that are being attacked in birth in hormonal contraception. So there's actually like a pharmacological and a politicized link here as well.
Absolutely. Thank you so much. We have one more question from the audience that touches on social media. And then if we have time, I have one queued up as well. So let's see if we can get through that. But we are we're getting close. From Ragnar Anderson. And we talked about this a little bit, but I actually think it builds more on the conversation. Social media and parasocial relationships seem to be very compelling sources of sexual and reproductive health information for all people, regardless of age. Thoughts about how to work with or counter these forms of information or misinformation, or to develop critical media skills? I know your TikTok series, Dr. Reagan, is squarely in that space, but beyond that?
Yeah, I'll just start by saying it was really interesting to be at the Society of Family Planning meeting recently, where this was like a huge topic of interest. And there were a lot of researchers presenting some of their preliminary findings, including Dr. Gomez, about this. And so I think we're going to know a lot more in the next year or so. And I will say that we are thinking very deliberately about sort of our work in this space. And doing research around like what messages resonate, what messengers resonate, where do we put them, what time of day do we put them, how do we better reach people, how do we use influencers in a positive way, since we know that people are using influencers to propagate misinformation. So a lot of learnings that are happening here, and hopefully we'll continue to do a good job, as our incredible research team has done today, to sort of share our findings and disseminate them widely so everyone can learn as we are learning.
But as a field, I think we haven't figured out yet how to strike the right balance between trying to bust myths and misinformation while respecting people's individual experiences as real. And it is only in the last year or two that pain upon IUD insertion has been respected as a real phenomena and not misinformation or and incorrect. That it's not just a myth perpetuated by social media. People put it out there because it was their real experiences. So listening to young people about their real experiences matter. And to just circle back, again, applause for Power to Decide for creating this survey to have a way for young people's voices to be heard and lifted up.
Yeah, and I'll just add, it's kind of like an uphill battle, right? Because folks who are not necessarily focused on providing evidence-informed information can generally like say anything, and often it goes unchecked. Whereas rightfully so, like we have to make sure that we're saying evidence-based, and that's not always like a tweet-sized, TikTok video-sized bit of information, right? Like how can I very succinctly talk about the cancer risks of hormonal contraception and say like, well, overall it's good, but there could be a slight increased risk of breast cancer, but overall, like your risk of breast cancer, if you're young and otherwise healthy, is small. So even a slightly increased risk is small. Like that's a very hard thing to do in a succinct and accessible way. And so like continuing to really push to make sure that we're honing our messages and finding ways to provide, you know, important public health information and clinical information in a way that folks can understand is going to be critically important.
The challenge of providing accurate evidence-based information in a micro bite while not also inadvertently elevating the misinformation that you are trying to counter is a Herculean task. It is something at Rewire News Group we think very intentionally about all the time. And for just the members of the audience who may not be, you know, really involved in social media spaces or even thinking about creation for themselves in social media spaces, let me tell you, a 30-second TikTok to get accurate information that will actually gain traction is like 10 hours of work. So truly just have respect for that. We do have another question from Jenny Oliphant. And this says, I did not see any information on HPV vaccination. Have you thought about including activism in this area too? Rates of HPV vaccination have gone down for the past 2 years.
I so appreciate the question. As somebody who like approaches my research from a sexual health lens, it's so hard to sort of parse out and focus in on specific topics. But we did sort of have to put some guardrails on what we included in the survey. And just given that HPV vaccination is measured in some other spaces, like the National Immunization Survey, also some information from the National Survey of Family Growth, and wasn't sort of a key outcome in relation to some of the information indicators that we were collecting, we did not include it. It is definitely something we can kind of think about as we're going forward with future cycles. And I think, you know, we are eager to examine trends. So do want to keep consistency in our data collection, but also do want to be flexible and have the opportunity to add additional indicators that would be important for the field.
Thank you. All right, we don't have any more questions in the queue, so I'm gonna take the moderator privilege and ask one of my own. What would you folks, and this is open to anyone on the panel truly, what would you like to communicate to members of the media about this survey and how to tell this story moving forward? Because I'm constantly helping my members of the media along, particularly when it comes to young people's access to sexual and reproductive health. This is a place where I think the media just consistently gets it wrong. Here is an opportunity to start to get it right. What would you like to share with us?
I'm going to share the same quote I've been telling reporters for two decades now, maybe 15 years, which is you cannot expect young people to Google their way to good health. And just because they have a cell phone that you think all that information is out there, and why do they need it from every other source? They're better on the computer than I am. Of course they can figure this out. This survey once again demonstrates to us that that is not the case. And they need the guidance and input from a range of respected and trusted actors to get truly correct and valid information.
Yes, that, and I would add that, you know, it's really critically important that our media colleagues are dealing with this information very sensitively and being sure that they are not propagating misinformation and stigma around sexual and reproductive health. We've seen so many examples, for example, of the conflation of emergency contraception and abortion pills and misinformation about other sexual and reproductive health topics in trusted, you know, respected news sources. So it's critically important that, you know, they're dealing with this very sensitively and that they use their resources. If they have questions, we're here to help.
And I would I have 2 points. I think one is this idea that information is part of access. I feel like for so long it's sort of been like, oh, information, and then we focus on access to care, which is focused on like what's happening in the clinic and can people get to the clinic, and all of those things are very important. It's part of the equation, but we also have to think about how the information that people have, what they know, what they think, that influences their decision making to even seek out care in the first place. Um, and so I think, in the same way that we've done a good job about sort of thinking about access to care and looking at systems and structures that create barriers on the sort of like provision side, we need to do the same thing on the information side. So as we incorporate information as part of this sort of equation of access, we need to make sure that we're also not stigmatizing individuals for what they don't know or what misconceptions they have, but recognizing that it is these larger systems and structures that are creating these gaps. And so how do we work to address them?
Sounds like we may need to do a power to decide briefing with members of the media, given just the top line answers there. Because truly, I do think that well-intentioned journalists often elevate mis and disinformation and perpetuate stigma by virtue of our training as journalists. I think folks feel like that is giving a robust picture without understanding that that picture that they're painting is in fact covers a point of view and is doing disservice when they don't mean to. So thank you all for your work in this field, for your time in thoughtfulness and approach to this subject. The autonomy and value of young people's experiences and ideas and, just thoughts moving forward about what's best for them is something that we don't take seriously in this country at all. And I think even well-intentioned folks in reproductive rights, health, and justice spaces sometimes cruise over that as well. And so it is wonderful to see this as a stepping stone. I am excited about the direction that Power to Decide is away from the idea that all effort needs to go from no teen pregnancy to just expanding and understanding teens and young people's experiences as full reproductive and sexual beings themselves. For folks who either are joining late or are just getting caught up to speed, really take your time and take a look at the study. I mean, the importance on the increased access to trusted and resonant data, I think, is something that jumps out as well to me. And this idea that, Riley, you just connected at the end, that information is actually a part of the access conversation and not something that needs to be siloed, is just really important. I think the fact that the survey has honed in on the reality that teens and young people are not getting information from their preferred sources, and those preferred sources are providers, is something really important in this age of social media influence for news and information generally to drive home. We still need what I would refer to as brick and mortar information sources, even in a digital age, and this survey really underscores that. And it's not just, as you folks have shown, access to contraceptive information. This is about the full spectrum, which includes abortion as well. Please, I encourage everybody on this webinar to look at the website, not just for the survey, but for the findings. Use the social media tools. I spend a large amount of my professional time, as I hinted at, on social media spaces, paying attention to the way that the wellness movement, conservative legal movement, conservative social media influencers talk about these ideas. And it is wild to where they are at compared to folks who are science and data driven. And we have a lot to catch up to. And this is an excellent start. Thank you to the participants. Thank you for everybody who submitted questions and followed along. There will be a recording of it. If there are follow-up questions, please submit them. The panelists have promised that they will answer. If you have the opportunity and interest, feel free to check out Rewire News Group and our podcast, Boom Lawyered. We do really try to take these issues head on in a science and data-driven perspective as well. And Dr. Reagan, anything else as we close that folks should know?
Thank you so much, Jessica, for leading us through this fun conversation. And again, huge kudos to Riley, Sierra, and the research team at Power to Decide. And thank you, Dr. Lindberg, for being here with us and helping us to create this survey. This has been really fun.
Amazing. Thank you. And just so folks remember, it's powertodecide.org/yourhealthsurvey. So check it out. Thank you for all the amazing work. And thank you for allowing me to be a little bit of a participant. Thank you.